Well, let me begin to describe the model, if you will, looking into the crystal ball. This chart lays out 4 generations of healthcare consumerism. Let me briefly describe them, and I'll come back to them in a little bit more detail. But on the left-hand side, you see traditional plans. Then you see traditional plans with some information that's sort of passive. It's out there. You may have some prescription drug information that's available online for people to look at, or some other resources. Decision support tools is the term that's usually used. The first generation consumerism is pretty much universal at this point. Most insurance carriers, most third-party administrators that offer up services will have a first generation consumer-driven healthcare. And this is the area and the term that most of you may have heard about. It's really a focus in this area on discretionary expenses. By having a high deductible plan with an account balance, you do change behaviors and there are some cost savings, but the cost savings are typically from office visits, emergency room stays, maybe some diagnostic x-ray and laboratory expenses. But the reality is that's the 20% of the population, that's the 80% of the population with only 20% of the claims. The real issue is how do you reach the 20% of your population with 80% of the claims? That's the real issue around ultimately holding down healthcare costs, those chronic and persistent conditions of asthma, diabetes, congestive heart failure, hypertension, cancer, etc. Well, in this first generation model, this focus on discretionary expenses is a starting point. We had to start someplace, and legislation and regulation is what created this new foundation. How can we even talk about consumerism? How can generation, as I've described it, has a number of vehicles that can be used and are being used in the marketplace today by the major carriers that are out there and most of the regional players in the market as well. But if that's where we stop, the system would fail. That is insufficient. Many of those are high deductible plans and are subject to some of the criticisms that it's only for the young and healthy and wealthy. But what's actually happening now is we're moving rapidly into the second generation. The second generation is a real focus on behavioral change. This is where the diabetes situation I described has a solution. And I'll hold off a little bit more description on that until the next slide. But the real critical issue and concept I want to get across in describing the generations is that the second generation, we are about a third of the way into, in my opinion, a second generation model that rewards and incents individuals based upon behavioral changes that are healthy. Third generation consumerism. This is also developing in the marketplace, but we're not there yet. It involves some changes that have yet to be made and metrics that have yet to be developed to allow us to move into third generation. But third generation is about integrated health and performance. It's about how healthcare affects your corporate bottom line. If people are doing the right things, if they're compliant with care, if all the first and second generation activities are going on appropriately, think about an employer's business. There are fewer unscheduled sick days, there's fewer absenteeisms, there's something called impaired presenteeism. That's being able to think about what you're actually doing when you're on the job, so you're there mentally and physically. You have fewer claims for workers' comp. So there's a lot of impacts that a good healthcare system and a healthcare consumerism approach will have on your overall organization. And we're seeing some of that develop out there in the marketplace today, recognizing the value of healthcare, not just in the healthcare line item budget, but in the overall corporate strategy. The fourth area of consumerism is where I think we're ultimately going, and again, we're seeing some companies and specialty vendors out in this fourth generation part of our market. They're developing very specialized and individualized tools. A good example of that is a company called HealthPia. Not to pick one company because there are many we can talk about, but HealthPia has, for example, what's called a diabetes telephone. I don't know how many of you may be familiar with that, but it's a telephone that has a device attached to it that if you are diabetic and you need to take your blood sugar 3 times a day, you can take it with this device. The results go off by telephone line and you get a call back with the results. If you're supposed to take your test 3 times a day and you don't, the system calls you and reminds you that focuses on you, focuses on me around our own individual healthcare needs.